Hi, I'm Tim Oram, Director of Legislative Services for the Hospital and Health System Association of Pennsylvania. 2010 had several important public policy issues that impacted Pennsylvania hospitals and the patients they serve. In March, the President signed the Affordable Care Act, which was the most significant health reform law since Medicare was created in 1965. It provides health insurance for most of the nation's uninsured by working to improve quality and lower costs. Later in the year, Governor Rendell signed a medical assistance modernization law conceived and advanced by the hospital community that provides hospitals with the additional funding needed to improve quality and safety for all patients. Your advocacy support was critical to this victory for the hospital community and helped to ensure that our state's most vulnerable citizens would continue to have access to quality health care. Next year will be an even more challenging year for hospitals and health care in our state. The state budget will have a $3 to $5 billion deficit, and Governor-elect Tom Corbett has said he would not raise taxes. This means a series of sweeping spending cuts are likely in the next budget, which will be announced in March and become effective in July. Because the medical assistance budget is one of the largest parts of the state budget, we are very concerned that funding for this critical safety net program will be cut. As Pennsylvania's hospital's main advocate, the Hospital Association is planning a major education and advocacy campaign to ensure that the medical assistance funding is not cut. You will be a critical part of this effort. If you haven't yet signed up for the Care for PA newsletter, please do so today so that you can stay informed about this critical issue. There are other key issues that will also unfold next year. In Pennsylvania, Governor-elect Tom Corbett indicated he plans to address the medical liability crisis in Pennsylvania to help recruit and retain quality physicians and other health professionals. Legislation like the Fair Share Act and phasing out the MCare program are two proposals the hospital community supports to reduce medical liability costs. Pennsylvania's outdated hospital licensure law and regulations will likely be updated to reflect the current way health care is delivered in our state. As you can see, 2011 will be a challenging year for our hospitals, and your help will be needed. Until then, we wish you and your family a joyous holiday season, and we look forward to working with you early in 2011 as these and other key issues will impact the future of hospitals and our state will be considered. Thank you, and happy holidays.